Okay, today I'm going to demonstrate how I would do an ABG puncture. So first I would review the patient's chart and confirm the order. Then I would wash my hands, put on my gloves, and enter the patient's room. I would introduce myself to my patient and make sure I had the right patient and inform him what I was going to do. Hi Bob, I'm Ashley with respiratory. Today I'm going to do an ABG puncture. Next I would gather everything that I needed, so my needle, my gauze, my label, and my alcohol cleaning. Then I would check for a pulse to make sure I could use this arm. Okay, so now I'm going to perform the Allen's test. So I'm going to occlude both arteries and close his hand and wait till it turns white. I'm going to release the ulnar side and open his hand and wait for it to pink back up no longer than 7 seconds, and it did, so we can use this arm. Next, I'm going to feel for the pulse again. I'm going to clean that area. And I'm going to get my needle. And I'm going to tell him that he's going to feel a stick. So, Bob, you're going to feel a stick. And I'm going to leave it in until I get 1 cc. And then take my gauze and apply immediate pressure for at least 5 minutes. I'm going to close up my needle and dispose it. And then I'm going to apply the cap. And then I'm going to release any air out of it that's in there. And then I'm going to rock and roll. I'm going to make sure my patient's doing okay, and then I'm going to put the label on it and put it in the bag, and then chart.